Welcome back to the Morning Blend. For some, getting pregnant is too easy. For others, it can be a heartbreaking struggle.
Yeah, today we're going to give you details about a very special women's wellness event for preconception planning. Joining us now is Dr. Trester from Moreland OB-GYN Associates and Dr. Kristine Sullivan from Women's Healthcare. Good to have you guys here.
Morning.
Hi.
Glad you made it with the weather. It's exciting. So this is a preconception planning event that's going on. Why is that so important? What types of things do you talk about with preconception?
Well, it's very common for women to come in and ask us questions about what they can do before they want to try and get pregnant, you know, things that they can do for their health. And the goal of this event is to give women kind of an open forum to meet with some, you know, expert people on the panel and ask questions and talk about what things they can do to increase their chances of getting pregnant and just optimize their successful pregnancy rates.
I think people hear a lot of things that will help them get pregnant. Some are probably based in myth, some are probably true, but give us a few examples of things that women can do preconception to improve their chances of not only getting pregnant, but having a healthy pregnancy too.
So one of the first things that you have to do is try to optimize any medical conditions that you may have. So talking to your doctor about something like that is really important. If you're on certain medications that might be harmful to a pregnancy, talking to a doctor about trying to transition off of some of those or to something that's safer. There's things you can do like starting a regular exercise routine, optimizing your BMI. That will all really help achieve pregnancy.
Yeah, this is an event I'll be at on Saturday. I'll be moderating and helping with it, and I can say firsthand, I learned so much by meeting, because I'm not trying to get pregnant at this moment, but in the future I hope to. And so I think a lot of women too, they're at that point of saying, well, maybe not now, but in the future, and I want to understand. And what I realized is we as women know so little about fertility until we're pregnant or until we're trying. So the types of topics you're talking about are, you know, infertility, like how to use IVF or freezing your eggs or natural pregnancy. You're covering the whole gamut of topics when it comes to women's wellness and fertility, right?
Yes. So the goal of the conference is to talk to people who are either trying to get pregnant or just considering at some point in the future that they want to become pregnant. And then what we'll do is through the different panel discussions, we'll talk about things that they can do to achieve a healthy pregnancy. We'll have expert speakers for regards to infertility treatment options if people aren't able to successfully conceive on their own.
Mm-hmm. And speaking of fertility, infertility, I think people, especially before they get pregnant, are always very interested to know how much age actually affects fertility, and I'm sure that's an important topic that you cover in your practice. But what can you say about that for people who are wondering about that specifically?
Well, unfortunately, age does play a large role in fertility, not only in the ability to get pregnant, but also to have a pregnancy without complications. So women, as you get older, are higher risk for difficulties conceiving, having miscarriages, having babies born with chromosomal or genetic conditions, as well as just an increased risk of having problems with diabetes or blood pressure in the pregnancy.
That's why some of the information on freezing your eggs is so exciting. But there's so many different things that you really go through, and that's why I think, you know, age, I mean, what do they say? Like, I don't think they call it geriatric anymore. What do they call it past 35?
Elderly, multigravid, or private
or advanced maternal age.
Advanced maternal age. And I mean, most of my friends are past 35 having kids, but they're really needing help, or they're needing to get all their hormones in order. Or for me, it was like upping vitamin D, different things like that. Talk about this test that you're doing, because we kind of tease that there's this one test that can help you know potentially likelihood of getting pregnant. It's AMH. Mm-hmm. And what is that? And this is an option you can do the day of the event if you come early.
Correct. So the day of the event starts at 8 o'clock, but if you arrive at 7 o'clock, we're offering anti-Müllerian hormone testing. What that is essentially a hormone that comes from the immature follicles in the ovary. And so that test gives you a good idea of what type of reserve you have left with those immature follicles that would potentially become an egg. So the results of that, although it doesn't tell you specifically whether you can or cannot get pregnant, it may tell you if you're a better candidate for types of assisted infertility treatments or how you may respond to some of those medications.
Yeah.
I tell my patients often it's kind of telling me how fast your biological clock is ticking, whether we need to be more aggressive or intervene earlier if you don't successfully conceive on your own in a short amount of time.
Mm-hmm. I remember hearing once that if you're trying to get pregnant and it's been 6 months or longer where you haven't been using some form of birth control and you're not pregnant, that you should seek more advanced treatment or other options. Is that still the case, or does it depend on your age?
It actually does depend on age. So women under the age of 35, we typically give up to 12 months of trying to conceive before seeking assistance or help. And women over the age of 35, we recommend seeking assistance after 6 months. Now, if people have irregular menstrual cycles, we don't want them to wait a whole year. We'd want them to come in sooner so we can try and see if there's an underlying cause for it or something that we can do to, again, increase their chances of becoming pregnant.
Okay.
Something else that's cool at the event is it's overall wellness. You even have acupuncturists and nutritionists there, because there's basically a part where people can go around and talk to all these specialists. Here are the doctors and such that are presenting. You've got a stellar lineup that's there, and there's just so many people that you can meet with and talk to about all different areas. Why would you bring in even an acupuncturist and nutritionist or whatnot to kind of round it out? Why is that important?
Well, a lot of it is just because we're looking at the woman as the whole person. So there's ways to relieve stress. There's ways to improve other ailments that may be causing a problem. And so we want to make sure that we're covering all of those topics as well.
One of the things I also wanted to mention, along with all those wonderful things, are that you're going to have a bump boutique that has local vendors, also a chance to win an IVF cycle, which a lot of people know can be very expensive. Insurance sometimes doesn't cover that. So that's really exciting for that to happen too. So people should definitely enter for that chance to win that.
You just have to be present to win?
You do have to be present to win, but you may gift it to somebody else if you don't end up needing an IVF cycle as well.
Wow. That's nice.
Okay, so it's this Saturday. Come and join us. It's this Saturday, the 26th. For general admission, it's $40. Again, it's kind of a panel discussion. I'll be moderating. The admission with that AMH testing is $60. For that, you have to arrive an hour early at 7 a.m. Otherwise, we begin at 8. You can enter to win the free cycle of IVF as well by attending and going to the Bump Boutique too, chatting with all these experts. The website is beforethebumpwi.com. That's where you can register. I really look forward to seeing you all there. So thanks, you guys.
Great event.
Thank you so much for having us.
Yeah, it sounds really cool. Thanks for joining us on the show today. We appreciate it.